Every year, 2 million of us experience domestic abuse.
I'm Elena.
And I'm Jenny.
We've been part of the DREAMS research project, exploring how staff working in mental health settings can provide people experiencing domestic abuse the care and support they need.
Importantly, we've brought our own lived experience perspective into this research.
We carried out a survey, conducted interviews and focus groups with mental health professionals and people with lived experience. Here is what we learned.
Opportunities for someone to disclose domestic abuse are missed because staff aren't asking. But staff don't feel trained, prepared, or confident to ask about domestic abuse.
Physical environments don't encourage people to open up, and individuals require environments where they feel emotionally safe.
Staff need to build trust and rapport through flexible, trauma-informed conversations that create opportunities for disclosure.
For example, I found the direct and abrupt questions very overwhelming, and it made me shut down completely.
Staff must understand the barriers such as cultural stigma, fear of disbelief, presence of the abuser, and misunderstanding of different types of abuse.
Stereotypes based on gender, age, or appearance may affect the way domestic abuse is approached. Mirroring language is important to recognize diverse communication styles, neurodivergence, and gender identity. It helps build trust too.
Poor integration between mental health and domestic abuse services forces survivors to repeatedly retell their stories, creating frustration, fatigue, and trauma. I have experienced this, having to retell your story when you see someone new, and it's very wearing. I want to be asked, but I also want you to talk to each other so this can be avoided.
These insights have helped us to develop a model of best practice to support healthcare professionals with training, identification, and responding to domestic abuse.
The right type of training will ensure staff feel confident, prepared, and have the knowledge to ask about and respond to domestic abuse.
This training should be co-produced and meaningfully involve people with lived experience. It should be in person and interactive.
Embedding therapeutic approaches will enable staff to better identify people who are experiencing domestic abuse, promoting safe opportunities to disclose.
When responding well to disclosures, staff will clearly demonstrate reassurance, belief, and validation.
If we can adopt this approach, we will be better able to identify and support people experiencing domestic abuse.
And then we will be able to help more people start to move forward with their lives.